as I mentioned in the previous, so when the doctor is checking the pulse and putting the finger, like root of the thumb, and then you place your 3 fingers. So you have to then see under which finger is more strong pulsation. And that will give you the idea about Vata, Pitta, Kapha. I will talk to you about that in a little moment. But the basic rules is very good to check the pulse in the morning. Why in the morning? Because this is the time when mentally the patient is more peaceful, more relaxed, and empty stomach is a good time, because as soon as you eat the food, the digestive process, creates some disturbance in the state of the doshas. Also, you can check the pulse at other times too, but if it is possible, morning, empty stomach, that will give you a more better understanding of the pulse. Peaceful mind is very, very important. Pulse is a meditative type of investigation. The patient as well as the doctor both should have a peaceful mind. They should sit very comfortably facing each other. There should be no kind of, sometimes I see that the patient is sitting across the table, doctor is sitting here, and you're just trying to reach out to the patient like this. You are very stressed yourself. You should be in a very comfortable position. That's why the best is to put the patient towards your right side on the small chair, or in a patient, there's a patient chair, which is very specifically designed for that. When the patient is checking the pulse, doctor should use the right hand if you are a righty. If you are a lefty, maybe you can use the left hand, but normally it's good to use the right hand because the patient is sitting on the right side. And with the left hand, you can give a support. So when you are holding the pulse like this, left hand should give the support to the patient, either in the palm, under the palm, or under the hand. And right hand of the males, it's better to check the right hand pulse of the males. And in case of females, it's better to check the left side, because the male energy is more prominent on the right side, female energy is more prominent on the left side. Avoid checking pulse immediately after exercise, or after exertion, after taking bath, or after just you have woken up from your sleep. Immediately is not a good time. At least there should be a gap of 1 hour at least, or when you have already done your daily routine rituals, like going to the toilet or taken a clean yourself, and so that is a good time. Immediately after food is also not good, because it may give you some wrong information, because after eating food, the digestive process is in action, and the pulse, sometimes you may find more pitta pulse will be there. Also, not to check pulse when someone is very hungry, or someone is very thirsty. It's not good. Or while somebody is sleeping, you cannot check the pulse of the person who is sleeping. And of course, immediately after massage also, this is not good to check the pulse. So these are some basic rules. As I just explained you in the previous slide, that how to check the pulse. This is a photo where you can see that the doctor is using the right hand, sitting in a very comfortable position, so that he can access the hand of the patient, and see how the left hand is being used to support the arm of the patient. Sometimes the patient maybe is told to put the elbow on the table, so it should be more relaxed. So it's not in the very stressed situation. So this is the photo that describes how to check the pulse. What we are trying to check, I already told you, under the index finger, if there is a strong pulsation, this actually gives you an indication that there is a vata aggravation. If the pulsation is more strong under the middle finger, this gives you an understanding that there is a pitta aggravation. And if it is under the ring finger, as you can see in the picture also, there is a vata, pitta, and kapha. The 3 things are mentioned on the arm. So this is a very, very basic way to check the pulse, and this definitely gives you the vikriti, the disturbance, the imbalance in the physical body or in other parts of the body. and this way you can at least try to understand the situation of dosha. This is a basic thing. There are other levels, pressure level, level 2, level 3, it goes up to 7 levels. I'm sure Dr. Ladd will speak about that, and he's quite expert in that kind of pulse checking. We have also the movement of the pulse, as described earlier. The vata pulse moves like a snake, so it moves like in a fashion like the snake moves. So it